Hey everybody, it's Anthony again with Tom Quigley. Wanted to just quickly walk you guys through an example of how you can actually stay with the same carrier that you're already using while still implementing our solution and getting the savings and better benefits for your people. So let me just quickly walk you guys through this. I'm going to share my screen with everybody. Okay, you guys should be able to see this now. What I did here, very simply, I took two different Blue Cross Blue Shield plans here in Pennsylvania. One is a gold plan that you can see right here. This is probably what most of you guys have from your broker. Secondarily is a bronze plan. This is what we're suggesting for your primary insurance. And then we did a quick comparison right here, and I'll break down everything in a couple of minutes for you guys. But as you can see right here, this plan has a $2,000 deductible, $8,700 out-of-pocket maximum. The monthly premium on this plan is about $2,300 for the year. That is going to cost you $27,534 in total for this family plan. And what we're saying here is with this bronze plan, if you guys were to actually buy this, look at the difference between the deductible out-of-pocket maximum and the cost. So you can see the deductible difference is $2,000 to $9,100. That's a $7,100 difference, but the out-of-pocket maximum is only $400 more. But what's really interesting about this is the monthly premium is actually about, what would you want to call that, $1,100 a month less than this same exact plan. Annually, it's going to cost you $14,500 as opposed to $27,500, totaling savings of over $13,000. And keep in mind, this is going to have the same provider network. It's the same type of plan with an HMO, and you're only assuming additional risk from an out-of-pocket max perspective of $400. Even if you wanted to compare a deductible versus deductible, okay, there's going to be co-insurance in the middle of that, but you're still saving $13,000 for $7,100 of deductible risk, when in reality, there's co-insurance and everything included in that. So that's not really apples to apples. So I'm going to hand it off the time really quickly to explain to you why it always makes sense to go with a bronze plan, just because simply you're saving more than the risk that you're assuming. And he could walk you through a large group example that ended up saving, I believe it was like $700,000 or $800,000 last year from working with us. And all they did was simply this. They said, hey, we're going to switch over from this gold plan with our same provider network over to a bronze plan. And underneath of that, we're going to implement the medical expense reimbursement plan. So Tom, I'll show this example. And then if you want to walk them through a actual MERP and how that works and what you can do and touch on the utilization as well, I think that would be super helpful.
Yes, all we did with this company is we took advantage of the insurance company's highest deductible plan with the same exact network, and knowing that less than 8% of people actually hit a $5,000 deductible, we were able to provide a better plan than they had prior. And they were able to keep 800,000. But if you think about it, if their EBITDA factor 7, we increased the value of the company by 5.6 million. Quite a bit of money. And they were able to go from a $2,000 deductible all the way to provide their employees to a zero deductible, make everything co-pays, make it easy so the employees actually understand. And all we're doing is taking advantage of all the programs that have been available since 1954 and showing people that they are literally paying more to the insurance company than the actual risk for the benefit side of things. The catastrophic, you need them for. And because of the ACA, the preventative, they're all built in. And you get a network. And if it's the same network and you pay less and you can give more, I don't understand why you would keep giving Blue Cross or United Healthcare or any of them more money than the actual risk. It does not make any sense. The insurance agents are rewarded on how much you pay. We're rewarded on how much we save you. It's just a paradigm shift, but you have to think differently. Been doing this over 20 years, written 3 books with my wife and tax attorney. There's really no excuse for anybody to allow the insurance companies to charge more than the rest. We're actually, you can actually save even more if you're willing to switch from the same carrier and do things differently. But step one alone, if you look back at this company, they're saving $800,000. That's what they saved. Net savings, 800, 3,000. It's a lot of money. The numbers are real. It's just a matter of allowing us to show you how not only do we save you, but how we manage it so it's more efficient than you've ever purchased insurance and benefits before. That's what we do. Hope people actually listen and pick up the phone and allow us to show you on a Zoom call.
Yeah, totally. And just to reiterate what Tom was saying there, this group here that saved 800,000, all they did was simply literally stay with their same carrier, went from a gold all the way to a bronze plan, locked in these savings for every employee that they're working or that's working for them, about 100 in total. And this is the end result. It's very simple. All you do is switch over, same provider network, same carrier. And this is easy. Step one, there's additional things we can do to save even more. But
yeah, this year they're going to save about 1.4 million because they're listening to all of our ideas. We caught their attention by saving them 800,000.
Exactly. And that's really the point I want to drive here, guys, is like, you don't have to switch over everything you've done for the last 10, 15, 20 years. All you can do is this one simple switch, go from a gold plan to a bronze plan, implement a medical expense reimbursement plan underneath of that to provide either the same benefits that your people are accustomed to, or even better benefits like this company did here with the $0 deductible, making everything a copay. And literally, here's the result. I mean, this is, exactly what Tom was saying. And, this company now, there's different things that we can do based on the prescriptions that their people have or medical conditions that they're dealing with, or getting claims data and seeing who's a high utilizer versus a low utilizer, and structuring the plan in different ways. But I just want to reemphasize the point that everybody on this call, who owns a business or is leading the benefit charge from an HR perspective, all you have to do is literally do a math problem, here on an Excel sheet or a sheet of paper, and say, hey, what would it look like if we actually did this for all the employees or for the entire group as a whole? So really, this is what I want to illustrate here. I don't want to, beat a dead horse and keep going over the same thing, but hopefully, you guys can take this information, do a little bit more research on your end, and then come back to Tom and I, and we could actually walk you through what this would mean for your company and what the savings would look like based on, the numbers and the documentation that you provide us about what you guys are currently doing with your plan. So all in all, really wanted to just hammer the points that, if you do this, the savings are going to be greater than the amount of risk that you're going to assume. That will lock in the savings. And then in addition to that, we have claims data over the last 20 plus years that utilization rates are under 8%. So, really wanted to touch on this. Hopefully this is valuable for you guys. Any questions that you have, or if you would like us to actually do an analysis of your company in particular, let me know. We can jump on a call to walk through this and, show you exactly what that would look like. And then, as we mentioned, from there, there's even further savings opportunities that we don't have to touch on right now, but they do exist in the form of grants, coupons, subsidies, etc. But just doing this alone is going to completely transform the financial well-being of your company and of your people while actually giving them better benefits. So appreciate everybody jumping on. Thanks, Tom, for contributing in here. And I will post this online as well in case you guys want to rewatch this and try to really comprehend, everything that we went through on the call. But any questions that you have, please do feel free to reach out and let me know. Thanks, guys. Bye.